pulmonary disease. This program also composing, taking into account the phase of the disease or period of exacerbation or remission, stage or of severity, presence and nature of complications, not less than 2 months shall be held. As for early rehabilitation, this form of rehabilitation can save the patient's ability to work and slow down the progress of disease. As for goals of this program for patients with COPD, should be directed, this program, on slowing disease progression and relief of main symptoms, to increase exercise of physical tolerance, prevent of disease exacerbations and complications. To the extent, on the extension of disease remission, prolongation of disease remission, reduction in the frequency of new hospitalization, these hospitalizations usually associated with exacerbations of chronic obstructive pulmonary disease due to respiratory infections usually. Also, we will try to prevent and minimize the side effects of pharmacological treatment, and of course, it will lead to improvement the quality of patient's life. The main methods of medical rehabilitations for patients with chronic lung disease and COPD, for example, include, of course, specific regime of physical activity, educational programs, psychotherapy, and a separate specific method, breathing exercises. A very important role in this rehabilitation program plays also so-called performed physical factors of physical therapy or physiotherapy, which you know, which you have studied in previous semester on our department too. These methods of physiotherapy include inhalation therapy with special hollow chambers. In this condition, patient can inhale any salt, especially which contain potassium and iodine ions, and this salt can can stimulate mucus releasing and sputum expectoration for clearance, for faster clearance of respiratory tract. Hyperbaric oxygen therapy for some patients we can suggest. You can see on the picture this procedure. It's hermetic chamber with high concentration, high pressure of oxygen. increase non-specific resistance by concrete methods of immunological resistance stimulation, such as therapy, or climatotherapy on special spa resorts. Spa treatment, as I said, and control spirography indicators we can apply. Before, at the beginning of rehabilitation process and after completing this process. Respiratory rehabilitation as a specific form of rehabilitation for patients with lung diseases includes the directed on management of patients' pattern breathing, improvement of this pattern, for improving the mobility of the chest, for training of the respiratory muscles by special exercise, and providing ventilation intersection of lung tissue. Improve ventilation for intact section. On this picture, is a special device, not digital, mechanical device for training of respiratory muscles with a resistance to inhalation and exhalation, both sides, both directions. So called Frollov's device. It was a medical specialist which have suggested this construction for the patients for readaptation, for rehabilitation of patients with respiratory disorders after pneumonia, for patients with bronchial asthma, after lung tuberculosis, and of course, for patients with COPD. The rehabilitation program of this rehabilitation also includes some positions, so-called postural drainage positions, to improve the drainage function of bronchi and for relieve the sputum expectoration from lungs, from low lobes, from bronchial lice. Also for this purpose, we can recommend vibrating massage, mechanical irritation of the chest in different parts, which also can stimulate the clearance of respiratory tract. Hollow aerosol therapy chamber, you can see. It is artificial imitation of microclimate or environmental factors, imitation of climate of mountain caves with high concentration of some salt. This high salt concentration is conducted through individual desktop halogenerators. Halogens. This salt contains halogens such as chloride and iodine. Halotherapy performed in halogen designed for till 10 patients. We can combine with positive influence on respiratory tract with pleasant music, with soft light and pleasant atmosphere of relaxation in very convenient armchair. During 20-25 minutes, it takes one procedure. Course of rehabilitation includes 10 procedures usually. How we can estimate the effectiveness of medical rehabilitations for patients with COPD? According to, we should estimate some criteria: clinical, functional, psychological, and even socio-economic criteria. Let's characterize each group. As for clinical criteria of efficiency of these rehabilitations for patients with COPD, we should estimate the achievement of cost reduction, dyspnea reduction, and exercise tolerance improving. Reducing the severe frequency and severity of disease exacerbations. Later, of course, prolonged criteria, long term. And exacerbations, disease of COPD, new cases of exacerbations for 1 year, for example. If we can achieve decrease amount of exacerbation 6 times for 1 year till 3 times or 2 even, it will really effective rehabilitative program. What helps to achieve these parameters? No, annual so-called rehabilitative program in the natural conditions on sea coast in some regions with favorable climate for respiratory tract, not so moist and not so hot. Mediterranean climate. As for minimization of pulmonary symptoms, it's also understandable. It's minimization of any respiratory disorders, especially cough with sputum, and dyspnea. And also minimization of blood changes, which are usually associated with COPD, such as polycythemia as compensating on hypoxia, and blood viscosity due to high concentration of erythrocytes, red blood cells. Functional criteria of medical rehabilitation efficiency of these persons with COPD. Of course, we should estimate spirography indicators. Which spirography indicators? The most informative so-called TIFNO index, or ratio between volume for first second of expiration to forced vital capacity of patients. Improvement of some hemodynamic parameters, such as heart rate, such as systolic blood pressure. And of course, we will try to increase blood oxygen capacity, which we can measure by pulse oximetry. As for psychological criteria of this medical rehabilitation, efficiency is also an important component which we can measure and which we can decrease, for example, decrease anxiety level by using of special, decrease anxiety level without specific anti-anxiety therapy. It's very important to underline. Optimal regime of physical activity and normalization, almost normalization of some respiratory indicators can help to decrease these anxiety level parameters. And also we should try to achieve increase in patients' involvement in the healing process. A real interest from patient and his family. His engagement in process of recovery. They should be interested by final results, by improvement there. Independence, physical and social independence from disease. Also, we can estimate it by special questionnaire and the influence on its level by specific intervention with participation of psychologists, medical psychologists, or psychotherapeutists. And finally, socioeconomic criteria of this rehabilitation program efficiency, which we can estimate, which we can define, estimate, and improve. Improvement of social adaptation. How we can characterize, how we can estimate it. It's more often participation in some social events, in social cultural program, without any problems with health. For example, admission of theater or music concerts without fear of any cause attack or dyspnea attack. Recovery ability to work. It's also very significant and most valuable maybe result of or criteria factors. If patient will be able to continue to return his previous occupation, or at least partially return his workability. Other criteria, it's reduction of temporary disability, duration of temporary disability, and for example, duration and sometimes duration of hospital treatment due to exacerbation. Even contraction on 3 days for each hospitalization case, it plays a very important, very significant influence on patients' psychological condition, on patients' self-assessment, and on patients' vitality. And all these factors can help to improve patients' life quality, patients and his family members' life. And now we come to conclusion of our lecture, and we should underline, I should underline for you that carrying out the complex treatment, including diet, physical activity, regime-specific, medical, physiotherapeutical, and psychological and social measures of rehabilitation in outpatient conditions can significantly improve the clinical course, clinical picture of chronic non-infectious, non-communicable, non-infectious disease, can improve patients' prognosis, prolongate their life expectancy, and improve life quality of our patients. Of course, this practical skill, this so-called art of day-by-day patients' rehabilitation, we should improve day by day according to modern requirements, modern principles of medical science and practice. And I wish you to achieve some successful, good success in this process if you perform, if you will organize and realize any rehabilitation programs for your patients in future practice. Now, our lecture is completed. You can ask me any questions. And of course, last slide, that rehabilitation success, it's a result of common efforts, health and social workers, psychologists, teachers, and of course, patient environment relatives. So it's common labor and common success. Don't forget about it. Now, any questions, if you want, you can ask me. For group leaders, thank you for your information about participants in our lecture. Next lecture of our course through 2 weeks as usual, 25th of March, 25th. If no any questions, then bye. Be healthy and careful, and see you on next lecture.
Thank you, sir. You too. До свидания.
Bye, good luck.